Welcome to Live Better Without Surgery. I am Dr. Joe Albano, and here we're going to talk about regenerative medicine and all things regenerative medicine, how or what it is, how you can use this to help your body perform better and live better, and you don't need surgery. Bit about my background. I am a medical doctor, MD, trained in a traditional way in family practice. Did my medical school in upstate New York in Syracuse, and then did a year of surgery training at Wright Pat Air Force Base and Wright State University in Dayton, Ohio. Spent a lot of time with the military. After that, I was a flight surgeon, traveled all around the world, then went back to my residency in family practice and then fellowship in sports medicine. Family practice was at the University of Utah, and sports medicine fellowship was at Michigan State. And I returned to Utah, and that's where we're recording this. I've been here for lots of years now. So today we're going to talk about regenerative medicine and what it is. There's a lot of names for it. Let's just start with that. So regenerative, as opposed to surgical, you're trying to regenerate tissues. Medicine or orthopedics is probably the better term because we're using it for orthopedic indications, anything musculoskeletal. So shoulder rotator cuff tears, knee arthritis, meniscal tears, hip arthritis, labral tears, anything musculoskeletal. And to compare the famous quote to the fat man in the house of God, for anyone who's read that book, it's a classic. You need to read it, and it's very sarcastic, so you got to be ready for that. But the fat man has all these rules, and one of them is there is no body cavity that cannot be reached with a 14 gauge needle and a good strong arm. So for us, it applies because we can reach lots of things musculoskeletally with needles, and we don't use the harpoons of 14 gauge needles. Usually people tend not to like that. We try to make people like us because we want people to be happy and live better without surgery. So if we can reach it with a needle, you can use it. And let's talk about what kind of things can be used for regenerative orthopedics. So you can use, there's two main groups of tissues that can be used. One is your stuff, autologous. The other is not your stuff, allogeneic. Let's start with allogeneic here. So not your stuff. Where do these tissues come from? Well, can come from the placental tissue or anything around the time of delivery of a baby. So placenta is one, amniotic fluid, amniotic sac, umbilical cord blood, umbilical cord, Wharton's jelly. All these are things that are allogeneic, not from you. Now, currently, at the time of this recording in 2024, it is illegal to use these products in the United States. You can get them still around, but it is illegal in most states, except now Utah just passed a law in May of 2024 where it is again legal to use it in the state, but it's illegal federally. So you figure that out. It's kind of like marijuana laws throughout the land here. Some states are legal, but it's not necessarily legal federally. So be that as it may, that's allogeneic products. And there's a role for these products. We've used them in the past, and they can help. So let's look at this, for instance, like amniotic fluid or cord blood are pretty common ones. How are these tissues obtained? So a woman delivers a baby, and these products are obtained from around the time of delivery. And note that the baby is not used. These are not embryonic tissues. The baby is not sacrificed for these cells. And this is an important distinction because a lot of people don't understand it. If you're using embryonic tissues, the baby is by definition now dead. And so these products are obtained, usually after abortions. And there's ethical dilemmas with this, obviously. And it's even kind of more suspect than that. Okay, first of all, you have to get beyond the ethical dilemma to use these tissues, but assuming you can, it's just not good. They don't work. There's a high percentage, I think it's up around 30% of times when you use these products in the studies that I've seen in the labs, that you get cancer produced. So it's just not good. And I think it's God's way of going, yeah, I don't think you're going to use my babies here. So we're not talking about embryonic stem cells. We're talking about the time around a delivery. This stuff is going to get thrown away anyway. And they do actually have live stem cells in them. So if you take these products and you put them in the lab and you look under a microscope, you can look at total nucleated cells. You can grow them in a dish and get colony forming units. And that's a way of measuring live stem cells in there. And there are live stem cells in there. However, in order for these to be processed and frozen, usually at minus 80 centigrade, and then transported to the doctor's office, you have to thaw them out. And there's just no live stem cells in here anymore. So don't be caught buying the snake oil that, hey, there's live stem cells in these tissues. Well, there are when it's fresh, but 100% are not fresh because you just can't get that. It doesn't exist. And we know this because of the studies that are out there. We've sent these samples when this was very popular back in the day. We'd send them to labs that we knew and trusted and saw how many live stem cells were in there, and no live stem cells in there. Lots of dead ones, though. Now, that doesn't mean these tissues are not still useful. Just don't fall for the, I want these young, fresh, healthy, 1-day-old stem cells. Well, no, it's snake oil. You're not getting stem cells out of there that are alive anyway. You are getting growth factors. So when we were using these products back in the day, it can help with lots of growth factors in a sense like platelet-rich plasma or PRP from the blood. I think of these things in terms of a strength equivalent that way, except they're much more expensive. Again, back in the day when we were using these, we would spend lots of money, like trying to remember the exact prices, a couple $1,000s for a cc of some of these products, and pass, of course, that expense along to patients. That's pretty expensive, especially if you're trying to do a procedure where you need more stem cells. Oh, wait, hey, I need 10, 20 cc's of this. That gets pretty expensive when you can use things that I think are better from the autologous world. So there is definitely a place for this. Usually they don't hurt if you put them into a joint, for instance. And we were involved in a trial that never got published back in the day, again, with one particular amniotic fluid product. And it did help people's knees. So again, growth factors equivalent to PRP really did help them out. And it was an okay thing to use. I don't think it's harmful in any way. Doesn't hurt a baby. There's no ethical dilemmas with this. Just happens to be illegal in most states nowadays. So not really much of an option now, but you need to be aware of it. The other group, not you, we talked about the not you, allogeneic. Now we'll talk about the group of cells that's from you. That's autologous. And they come in 3 major varieties. Platelet-rich plasma, PRP from your blood, is the first one. And again, I think of this in terms of a strength hierarchy. PRP, again, will be about the equivalent in strength of these allogeneic amniotic-ish tissues, except there's pretty much an unlimited supply. You're not limited to a cc or 2, and it costs a lot less money to do that. You can draw 60 cc's of blood, 120, 180, and you could concentrate these down and get lots of growth factors in there. So you just have a bigger volume, and I think it works even better then. the amniotic allogeneic kind of tissue. There's the PRP, and let's stop there for a second. So PRP, there's three main components of blood. There's red blood cells, of course, which are really good for oxygen carrying capacity. So when you're out running or biking or swimming, you want more red blood cells. It's really good for carrying the oxygen. And the more oxygen you can carry and use, the faster and longer you're going to be able to go. So any kind of endurance athlete knows that this is really important. And hence blood doping, athletes have done in the past, and probably some still do, where you just get more red blood cells in your body, and that's going to help you perform better. And there's other ways to do that illegally. You know, cycling world is famous for this in the last 10 plus years. And EPO is one way to do this. Testosterone is another way to do this. There's lots of ways for this to be accomplished. But when we're talking about regenerative purposes, red blood cells aren't really doing anything, but it is a component of blood. So you can process these. In the beginning, when we started doing this in 2007, we were using this harvest centrifuge, and it's really red and bloody because we were getting lots of red blood cells in there. It still worked, but nowadays the consensus is red blood cells don't really help with regenerating any of the tissues. So we try not to get those. And there's various kits you can use out there, PRP kits, or you can create your own in a hood and do this and get less red blood cells. There's ways to accomplish this. So the next thing in there in the blood is platelets, of course. And that's really what we want to get with platelet-rich plasma, hence the name, right? PRP. Getting more platelets is ideal. You're never going to get 100% of these platelets in there. So say you're starting off with 100% of the platelets, you just can't capture 100% no matter what. But you do your best to try and get it. There's various ways to prepare this. There's single spin techniques, double spin techniques. Single spin techniques kind of spread the platelets out throughout the serum on the top of it. And you can't just get it as concentrated as with the double spin techniques. Those you get a higher concentration of the platelets in this buffy coat layer, and you can just get more platelets and a higher concentration if you use them. And again, there's various systems out there that are commercially available for this. And then the last major component in the blood is white blood cells. This will, whether you want to use the white blood cells is debated now, but seems to be the consensus is that for soft tissue like tendons, you would want to use white blood cells because you're going to have more beneficial healing effect with the white blood cells in there. Perhaps not so much if you're putting it into a joint. So you may not want to put white blood cells into the joint, or many white blood cells into the joint. And there are systems out there where you can, in the office, check the levels, excuse me, of all of these white blood cells, red blood cells, platelets, before you concentrate them and then afterwards. And we have one of these systems in our office now, this Hariba machine, CBC machine, complete blood cell counter. And you can check this, and we do this on every patient. And it's very helpful because then we can see what kind of counts we got. Every single person is different. Say the manufacturer of a certain system says, we get 5 times the platelet concentration with our system. Well, you may or may not get it, and you'll be able to tell with this machine. So we do that. And then we also have a database that we're a part of, this Data Biologics, and we keep track of all of our patients in there. We can also see what other doctors have done. Of course, we don't know the doctors, we don't know the patients, but we can see their accumulated data for PRP and knee osteoarthritis. We can see how well they have done. And so it's really a handy tool to show our patients and give them a visual of this is kind of what you can expect. And of course, every doctor thinks they do better than all the other guys. So we can say, we do better than that. So yeah, that's just the standard, but we'll do better. That may or may not be true. but you can prove it. You can look and see how everybody else is doing. And let's see. So that is the PRP. Then we get to, in terms of the strength hierarchy, I'm going to go back one step. So let's just briefly talk about what's bad before we're putting these things in. So I am going to demonize steroids once again, because steroids, they do not heal or cure anything. Every time you put a steroid into wherever you're putting it, a joint, for instance, you're damaging the tissue, the cartilage in there, and it's making it worse in the long run. You're degrading it more. So there's really no reason to do steroids nowadays, except it's covered by insurance. So let's go down that road here for a second. Let's demonize the insurance companies because they're evil. They are in the business of making money. How do they make money? By denying claims and delaying payments. That was what one of my attorney friends said to me. And you know what? I was skeptical at first. I am no longer skeptical about that. There's a local insurance company. We'll talk about this. I think this is kind of funny. So we'll use the name. It's called Intermountain Health Care. But oh wait, no, they changed their name recently. So they took the care out of their name. So they're just Intermountain Health. So I joke saying, oh yeah, we're Intermountain Health. We don't care anymore. That's what the University of Utah should say in their advertisements, but they don't. They're too nice. So don't be deluded that insurance companies are out there to help you. They're not your friends. They're there to deny your claims and delay our payments to the physicians. Their goal is to not pay for anything. That's their goal. That's how they make money. And you see that, you get frustrated when you try to get an MRI authorized, for instance. Oh, well, wait, you haven't had x-rays. You haven't had a steroid shot. You can't get that HA injection in your knee because you haven't had all these other things. So insurance companies are not our friends. Steroids are bad. Another thing below PRP we'll talk about is Prolotherapy, and there's various solutions that are used for this. Dextrose is a very common one, and we will use this, and I like this, especially for knee arthritis. What happens with knee arthritis, we look at x-rays and we see decreased joint space, or we look at MRIs and we see degraded cartilage, or surgeons will go in and look with scopes and see potholes in the cartilage, or thin cartilage, or frayed cartilage, or torn cartilage, and they'll go in and trim these things up. Really what's going on with arthritis, though, are these inflammatory cytokines that are irritating the synovium, and that's what's causing the pain. And a lot of these regenerative orthopedic treatments are designed to decrease these inflammatory proteins. But before that, we'll flush the knee out with dextrose, kind of like the surgeon does when he does a scope. And that is like the best power washing in the world. You get tons of these inflammatory proteins out that I just can't achieve in the office setting. But instead, we'll put an amount of sugar water, 10% dextrose in the knee, and then take it out. And a lot of times, times patients get to the parking lot, they feel better because there's so many fewer inflammatory proteins in there. They're not gone, but they're decreased considerably, and they feel a lot better. It's not going to last, but that's why we use these other regenerative items like PRP, etc., in order to decrease the production of these proteins. So Prolotherapy is good, and this is not the traditional use of Prolotherapy. The purists will use it in a different manner, but we use dextrose to flush the knee out, and it really does help. So steroids are bad. Dextrose is good. PRP and any of the allogeneic products are about the same. Better than that, let's talk about that now. Stronger, more of an inflammatory response is caused by bone marrow. And how do you get the bone marrow, you ask? Well, I kind of have a big nail and hammer, and I get it from the posterior superior iliac spine, posterior part of your pelvis. And patients generally don't like it when I come at them with a hammer and a nail, so A lot of times nowadays, what we'll do is we'll bring in my anesthesiologist buddy, give you propofol, and you're asleep for the whole thing. And patients like it. You don't have to do it. I've done it. I've had bone marrow done on me 4 times now. 3 I was awake. Once I was asleep with the propofol. I kind of want to watch, so I'm okay being awake, and it really didn't hurt. It just felt weird, like somebody's hammering into my pelvis. That's kind of a weird feeling, but it didn't really hurt me, and I was okay with it because I got to watch. But most patients are not like that. They want to be asleep. We can do that. The bone marrow has a lot of mesenchymal stem cells in it. Blood really just doesn't have any in it. There's very few, essentially none. But bone marrow does, and it has mostly these hematopoietic stem cells, which will grow new blood vessels around the area or help to grow new blood vessels. But any of these treatments, the way they really work is you put them in the location and then they call other cells to the area to help heal it. We used to think it's like magic. You put it in there and it magically becomes cartilage or bone or muscle or whatever it is. I think of that like Calvin and Hobbes. So those of you who are old enough to remember Calvin and Hobbes, Calvin's this little precocious 5-year-old boy with his stuffed tiger that comes to life when he's with him alone, but there's other people around. He goes back to being a stuffed tiger, and he has all these adventures. And one of the adventures he has is a cardboard box. He turns that into a transmogrifier. So the transmogrifier changes Calvin into anything he wants. He can be a dinosaur. So he transmogrifies into a dinosaur. And we used to think that's how stem cells work. You just put them in and they get transmogrified into cartilage, bone, muscle. And it's just not true. That's not how it works. And we now know that it's different than that. And a more appropriate name is medicinal signaling cells. So you can think of it that way, but still MSCs. But everybody knows this is stem cells, so that's what people will call it. So it has lots of these MSCs in there, the bone marrow. And fat has even more, though. Has way more MSCs than does the bone marrow. And if you use that and put it in any musculoskeletal tissue, it kind of magically knows what to be. So plastic surgeons have been using this for a long time. So they will take fat from some body part, buttocks, thighs, wherever, and put it into the breast, into the fatty tissue in the breast. And you now have more fatty tissue up there. It doesn't turn into an eyeball or an ear or even muscle. It turns into fat. So your body knows what it should be based on where you put it. You put it into muscle, it's going to be muscle. You put it into tendon, it's going to be tendon. You put it into cartilage, it's going to be cartilage. And it's kind of cool that way. So there's been no studies or case reports of this turning into cancer that I'm aware of, that I've seen in any of the literature ever on either one of these products, any of them. And I'm going to take a step back because with the bone marrow, if I were to take my bone marrow and put it into you, that's not going to work. Why? Because your body's going to reject it. It's going to look at it as not self, and your body's going to say, and it's going to cause a reaction against it. Same thing with the adipose and the blood. So we really don't want to do that. But that's not true for these allogeneic products. Think about that. Why is it you have a mom and she's got a baby in her uterus, and this is a new and different individual from her, but yet her body doesn't reject this. It nourishes it and the baby grows. Same thing with your body. If we take these allogeneic, placental, amniotic fluid kind of tissues and put them in your body, it doesn't get rejected. It's kind of cool that way. And I didn't mention that before. So going back to the adipose, oh boy, I love using adipose. It's so great for healing lots of things because of this inflammatory healing potential is so great. And you can use it in conjunction with PRP and our bone marrow in different tissues. It is good for, I call it spackling or filling in the gaps. Think about this. If you have a tendon that is torn, it's not like you cut a piece of paper with scissors. That is not how tendons tear. It's more like rotten shoe leather. Rotten shoe leather, you ever seen that? It just cracks and goes in all these different directions. So you want to fill in these holes with the spackling, and adipose is thicker than blood. Blood is a fluid and it'll just kind of run out. And you use the adipose to fill in these holes, and it can work really well that way. So for any kind of rotator cuff tear, tennis elbow, which is a tendon tear in the elbow, it's a great use for that. And you can use the PRP in addition to the adipose and or bone marrow in these places, and it just causes an additive effect. So in summary, we have tissues that are not from you, allogeneic, which would include amniotic fluid, amniotic sac, umbilical cord blood, Wharton's jelly, placenta, or stuff that's from you, autologous, PRP, bone marrow, fat. Steroids are bad. Dextrose is okay, not as good as PRP, but still a pretty good thing. That is a brief summary of regenerative orthopedics. And I am Dr. Joe Albano, hoping that you will live better without surgery.